Congestive heart failure, often simply called heart failure, is a serious condition that sounds more sudden than it often is. It doesn't mean your heart has stopped working completely. Instead, it means your heart muscle has become too weak or too stiff to pump blood as efficiently as it should. Think of your heart as the body's powerful central pump. Its main job is to send oxygen-rich blood to all your organs and tissues. When this pump loses its strength, it can't keep up with the body's demands. This creates a backlog, a traffic jam of sorts, in your circulatory system, which can have far-reaching effects on your overall health and well-being. The term congestive comes from this very backup of blood flow. As the heart struggles to push blood forward, fluid can build up in various parts of the body. Most commonly, this fluid collects in the lungs, which is what causes the shortness of breath that many patients experience. It can also accumulate in the legs, ankles, feet, and even the abdomen, leading to noticeable swelling. This process puts extra strain on the heart, creating a cycle where the weakened heart works even harder, often causing it to become larger or thicker, which can worsen the problem over time. It's a progressive condition that requires careful management. Several underlying health issues can lead to the development of congestive heart failure. The most common cause is coronary artery disease, where the arteries supplying blood to the heart muscle become narrowed or blocked, starving the heart of essential oxygen and nutrients. Another major contributor is high blood pressure or hypertension. When your blood pressure is consistently high, your heart has to pump against greater resistance, much like trying to push a door open against a strong wind. Over many years, this constant extra effort can wear out the heart muscle, leading to its eventual failure to pump effectively. Other conditions can also damage the heart and pave the way for congestive heart failure. For instance, a previous heart attack can leave behind scar tissue that doesn't contract properly, weakening the heart's overall pumping ability. Diabetes is another significant factor, as high blood sugar levels can damage blood vessels and the nerves that control the heart. Problems with the heart's valves, which act as one-way doors for blood flow, can also cause heart failure if they don't open or close correctly. Sometimes the cause can be a viral infection that inflames the heart muscle, or even genetic factors that are passed down through families. Recognizing the symptoms of congestive heart failure early is crucial for getting timely treatment and improving your quality of life. One of the most common and telling signs is persistent shortness of breath. You might notice it during physical activity like climbing stairs, but as the condition progresses, it can happen even when you are at rest or lying down. Many people find they need to prop themselves up with several pillows at night just to breathe comfortably. This happens because fluid is backing up into the lungs, a condition known as pulmonary edema, making it difficult for them to expand fully. Another key symptom to watch for is swelling, medically known as edema. This is most often seen in the lower extremities, your legs, ankles, and feet. You might notice that your shoes feel tighter than usual, or that pressing a finger into your skin leaves a temporary indentation. This swelling is caused by the heart's inability to pump blood effectively, which allows fluid to leak out of the blood vessels and settle in the tissues due to gravity. Rapid and unexplained weight gain, such as gaining several pounds in just a few days, can also be a sign of this fluid retention. General and persistent fatigue is also a hallmark of heart failure. When your heart can't pump enough oxygen-rich blood to meet your body's needs, your muscles and organs don't get the fuel they require. This can leave you feeling tired and weak all the time, making even simple daily tasks feel exhausting. Your body essentially diverts blood away from less vital areas, like your limbs, to supply the brain and other critical organs, contributing to this profound sense of weariness. A persistent cough or wheezing, sometimes producing white or pink-tinged phlegm, can also occur due to the fluid in the lungs. Certain groups of people are at a higher risk of developing congestive heart failure. Age is a significant factor. The risk increases as you get older, particularly after the age of 65. Individuals with a history of heart-related conditions, such as a previous heart attack, coronary artery disease, or high blood pressure, are prime candidates. Lifestyle choices also play a huge role. Those who are overweight or obese, smoke tobacco, consume a diet high in salt, fat, and cholesterol, or live a sedentary lifestyle with little physical activity, are putting themselves at a much greater risk for developing this serious condition. When congestive heart failure takes hold, it physically alters the structure and function of the heart. To compensate for its weakened state, the heart often tries to adapt in ways that are ultimately harmful. One common change is that the heart's chambers, particularly the ventricles, which are the main pumping chambers, may stretch and enlarge. This is an attempt to hold more blood to pump out with each beat. However, this stretching makes the heart muscle thinner and weaker, reducing its pumping efficiency even further. This condition is known as dilated cardiomyopathy, and it's a downward spiral. In other cases, the heart muscle responds to the extra strain, especially from long-term high blood pressure, by becoming thicker and stiffer. This is called hypertrophy. While a thicker muscle might sound stronger, it's actually less elastic. A stiff heart muscle doesn't relax properly between beats, which means it can't fill with enough blood before it pumps. This reduces the amount of blood sent out to the body with each contraction. Both of these structural changes, an enlarged heart or a thickened heart, impair the heart's fundamental job of being an effective pump for the body's circulatory system. Fortunately, there are many effective treatment options available to manage heart failure, slow its progression, and improve symptoms. The foundation of treatment is often a combination of medications. Doctors may prescribe ACE inhibitors or ARBs to relax blood vessels and lower blood pressure, making it easier for the heart to pump. Beta blockers can slow the heart rate and reduce the heart's workload. Diuretics, often called water pills, are essential for helping the body get rid of the excess fluid and salt, which relieves swelling and makes breathing easier for the patient. Beyond medications, lifestyle changes are absolutely critical for managing congestive heart failure. Adopting a heart-healthy diet that is low in sodium is one of the most important steps, as salt causes the body to retain fluid. Patients are often advised to weigh themselves daily to monitor for rapid weight gain that could signal fluid buildup. Regular, gentle physical activity, as approved by a doctor, can help strengthen the heart and improve overall fitness. Quitting smoking and limiting or avoiding alcohol are also non-negotiable steps to protect the heart from further damage and improve its function over the long term. Preventing congestive heart failure starts with managing the risk factors that lead to it. The most powerful tool for prevention is a healthy lifestyle. This means controlling your blood pressure through diet, exercise, and medication if needed. It also involves keeping your cholesterol and triglyceride levels in a healthy range to prevent the buildup of plaque in your arteries, which is the root cause of coronary artery disease. If you have diabetes, managing your blood sugar levels diligently is essential, as high glucose can cause significant damage to your heart and blood vessels over time. Making smart daily choices can have a profound impact on your long-term heart health. Aim for a balanced diet rich in fruits, vegetables, whole grains, and lean proteins while minimizing processed foods, sugar, and unhealthy fats. Regular physical activity is key. Even 30 minutes of moderate exercise like brisk walking most days of the week can make a huge difference. Maintaining a healthy weight reduces the strain on your heart. And of course, if you smoke, quitting is the single best thing you can do for your heart and overall health. These are not just suggestions, they are vital actions. For those already diagnosed with heart failure, it's important to know that you can still lead a full and active life with proper management. In addition to medications and lifestyle changes, some patients may benefit from advanced medical procedures or devices. For instance, implantable cardioverter defibrillators, or ICDs, can monitor heart rhythms and deliver an electrical shock to correct dangerous arrhythmias. Cardiac resynchronization therapy, which involves a special type of pacemaker, can help the heart's chambers beat in a more coordinated and efficient way. In the most severe cases, a heart transplant may be considered. Living with congestive heart failure is a journey, not a final destination. Early detection and consistent management are the cornerstones of a positive outcome. It is a chronic condition that requires ongoing attention, but it is manageable. Working closely with your healthcare team, taking your medications as prescribed, and embracing a heart-healthy lifestyle are your most powerful allies. Remember, you are in control of many of the factors that influence your health. With the right knowledge and support, you can successfully manage heart failure and continue to enjoy a meaningful life.